Welcome to The Explainer. Today, we're going to dive into one of the most fascinating and honestly totally hidden drainage systems inside the human body. Think of it kind of like the plumbing hidden behind the pristine dry wall of a luxury home. You literally never realize it's there, quietly doing its job, right up until a pipe breaks and ruins everything. Well, we are exploring your body's hidden drainage network and what exactly happens when it fundamentally fails. It's a really incredible topic that blends intricate anatomy, these compounding cellular traps, and some truly mind-blowing innovative microsurgery.
But to really understand the sheer scale of what we're talking about, we have to start right here. 140 to 250 million, that is how many people globally are living with this condition, which is called lymphedema. So this isn't just some obscure, super rare medical anomaly. No way. Actually, the underlying disease that causes this in much of the world is recognized by the World Health Organization as the second leading cause of permanent long-term disability on the entire planet. It only trails behind leprosy. It's a massive global issue that completely alters the daily lives of millions of people.
Okay, let's dive into this. Here is our roadmap for demystifying this condition today. First, the hidden drainage system. Next, when the pipes break. Then, the vicious cycle, spotting the signs, and finally, taking back control.
Section 1. The hidden drainage system. Basically, your body's cleaning network.
So, imagine your lymphatic system is this highly advanced biological waste disposal network. It's working silently, 24 hours a day, right alongside your bloodstream. And this brilliantly illustrates the actual pathway. It starts all the way down at the cellular tissue level. Right there, you've got these initial lymphatic capillaries acting like millions of tiny little sponges, and they're constantly soaking up excess fluid, cellular debris, and proteins that naturally leak out of your blood vessels. From those tiny sponges, the fluid gets pushed through pre-collector pipes and into larger collecting vessels. And nature's pretty smart. These vessels have specialized one-way valves, so gravity can't just pull the fluid backward. Along the way, this fluid, which we call lymph, passes through these little filtration stations, your lymph nodes, before ultimately dumping everything safely back into your venous bloodstream. It is just a perfectly engineered, self-contained loop.
And this plumbing network handles three absolutely critical daily functions. First, it maintains fluid balance. Basically, it stops our arms and legs from swelling up like balloons. Second, it absorbs fats and lipids straight from our gut after a meal. And third, it provides vital immune surveillance. Because it picks up foreign invaders and delivers them straight to the lymph nodes, it's essentially calling in the immune cavalry to fight off infections. So, the stakes here are incredibly high. When this perfect system fails, and all that protein-rich fluid begins to just stagnate, the consequences are honestly devastating.
Moving on to Section 2, when the pipes break. We'll look at primary versus secondary causes.
Medical science shows us that there are basically two distinct ways these physiological pipes can break down. On one side, you have primary lymphedema. This one is entirely driven by genetics. A person is simply born with missing or underdeveloped lymphatic vessels. But it's extremely rare, happening in only about 1 in 100,000 people. Contrast that starkly with secondary lymphedema. In this scenario, a person is born with perfectly healthy, fully functioning plumbing, but some external event physically damages or blocks those healthy pipes. This secondary form is the one that affects those massive crowds of people worldwide.
So, you're probably wondering, what exactly are these external events? Well, in developed nations like the US, the leading culprit is actually life-saving cancer treatment. Up to 50% of patients treated for certain cancers, especially when lymph nodes are surgically removed or targeted with radiation, end up developing this. The radiation literally burns the microscopic pathways, leaving behind thick scar tissue that blocks the fluid. Globally, though, especially in tropical regions, the main blocker is a parasitic infection called lymphatic filariasis. It's wild to think about, but a tiny, almost invisible mosquito bite transmits microscopic worms that grow into adult parasites, creating a massive physical roadblock in the vessel networks. Other major triggers include severe trauma, massive burns, and severe obesity, all of which essentially crush or overload the system.
Section 3. The vicious cycle. From fluid to fibrosis.
So the crucial point is lymphedema is absolutely not just harmless water weight. When the pipes get blocked, this deep compounding cellular cascade kicks off. Let's walk through this step by step. First, you get lymph stasis. The fluid just stops moving. But remember, this fluid is packed with proteins, which makes it highly reactive. That stagnant, reactive fluid triggers step 2, chronic, smoldering inflammation. Now, this is where it gets really unexpected. That chronic inflammation actively stimulates the fat cells in the lymph to multiply and grow. This is step 3, adipose hypertrophy. The body is literally building new fat tissue in response to the trapped fluid. Finally, step 4 hits, fibrosis. The tissue begins to scar, turning stiff and woody. It's a vicious biological trap. The swelling triggers fat and scarring, and then that dense scarring turns right around and crushes whatever healthy lymphatic vessels were left. It's exactly why stepping in early is so absolutely crucial.
And I love this quote because it completely shatters a really common misconception. Excess limb volume is largely due to fat deposition, not just fluid. You literally cannot just take a needle and drain a late-stage lymphedema limb like it's a water balloon. The limb has fundamentally changed its architecture. It isn't just a fluid problem anymore. It is fully transformed into solid fat and dense scar tissue.
All right, Section 4, Spotting the Signs, Diagnosis and Staging.
Knowing exactly how this plumbing breaks down, doctors rely on some very specific physical signs to catch it. One of the simplest, most reliable diagnostic tests is called the stemmer sign. You can actually try this right now. Just pinch the base of your own second toe. Notice how thin and pliable healthy skin is supposed to feel? Well, if a patient has a positive stemmer sign, the skin there is so thick, swollen, and taut that it is physically impossible to pinch and lift it. And as the disease gets worse, you'll see other visible skin changes, like hyperkeratosis. That's where the skin gets excessively dry, flaky, and can even sprout wart-like growths, all thanks to that relentless chronic inflammation bubbling just beneath the surface.
Now, what's really interesting about this slide is how clearly it contrasts lymphedema with lipedema. This is a super common confusion in the medical world. But look at the differences. Lymphedema is almost always asymmetrical, meaning it usually strikes just one arm or one leg. It's generally totally painless, and crucially, it almost always involves the foot, giving you that positive stemmer sign we just mentioned. Lipedema, on the flip side, is symmetrical. It hits both legs equally. It is often super painful when you press on it, and fascinatingly, it stops right at the ankles. The feet remain completely unaffected, so the stemmer sign is negative. Knowing these differences is basically the golden rule for getting the diagnosis right.
And getting an accurate early diagnosis matters so much because, frankly, time is working against the patient. The International Society of Lymphology tracks this using a timeline. Stage 0 is latent. The pipes are damaged, but there's no visible swelling quite yet. Stage 1 is that golden early window of opportunity. The swelling is soft, and it features pitting edema, meaning if you press your thumb into the skin, it leaves a visible dent. At this point, the swelling is actually reversible just by elevating the limb. But if it's ignored, we cross a major threshold into stages 2 and 3. Fibrosis sets in and hardens the limb. The swelling won't leave a dent anymore, the changes become irreversible, and by stage 3, you're looking at massive, disfiguring elephantiasis.
Which brings us to Section 5, Taking Back Control. Let's get into management and surgery.
So, while there's no absolute magic pill or one-time cure once the system is severely damaged, modern medicine does offer incredibly powerful ways to manage the overflow. The absolute cornerstone of conservative care is complete decongestive therapy, or CDT. And make no mistake, this is a major lifestyle commitment. It starts off with manual lymphatic drainage. This is a specialized, very gentle massage to manually route the trapped fluid toward healthy, working vessels. Next, multi-layer compression bandages are wrapped tight to keep the fluid from rushing back. Patients then do remedial exercises, which essentially turns their own muscles into internal pumps, pushing against the bandages. And finally, meticulous skin care is mandatory. Because the local immune system is compromised, a tiny scratch from a pet or a rosebush can instantly turn into a massive life-threatening infection. But when this routine is followed diligently, it literally gives patients their mobility and their lives back. For the really severe cases where standard therapy just isn't cutting it, surgical intervention can step in. And there are two totally different philosophies here. The first is physiologic surgery. This is where doctors are actually trying to rebuild the broken pipes. Using mind-blowing super microsurgery, they might do an LVA, taking a backed-up microscopic limb pipe and plugging it directly into a flowing vein to create a tiny bypass. Or they might do a VLNT, which is physically transferring healthy lymph nodes from elsewhere on the body directly to the damaged area. The second philosophy is excisional surgery. This is used when the limb has already turned to solid fat and scar tissue. Surgeons use specialized liposuction to vacuum out the dense fat, or in extreme cases, they perform a Charles procedure, which means physically carving away the hardened fibrotic tissue to manually resize the leg.
But you've got to remember this absolute critical caveat. Every leading specialist agrees on this. Even with the most cutting-edge, million-dollar microsurgery, it is only an adjunct. It is definitely not a replacement. It never ever replaces the need for compression therapy. Patients still have to commit to wearing compression garments for the rest of their lives. Otherwise, that fluid is just going to pull right back up. It truly is a lifelong partnership between the doctor's surgical intervention and the patient's daily dedication.
We've seen just how incredibly fragile, yet utterly fascinating this hidden network really is. But the good news is, medical science is advancing at lightning speed. Doctors are now using microscopes to stitch together tiny vessels that are thinner than a human hair, and researchers are studying molecular signals that might actually command these dead pipes to regrow. So I want to leave you with this thought to chew on. As super microsurgery and molecular therapies continue to advance, could we one day completely regenerate the human drainage system and finally cure lymphedema for good? Thanks so much for joining me today to explore this incredible hidden world inside us. Keep learning, keep questioning, and I'll catch you next time.